Hello, this is part two of the vascular system, and we're starting in the pulmonary circulation. So we're looking at part two. And the pulmonary circulation, let's see, you want to get on page 300 for that. The pulmonary circulation routes blood to and from the lungs to exchange carbon dioxide for oxygen. It doesn't supply the lung tissue itself with oxygen. Those needs are met through the systemic circulation. So blood leaves the right ventricle through the pulmonary trunk, which branches into the right and left pulmonary arteries. So blood, and there's a nice animation here, but I'll just go through this with you. So blood leaves it goes from the right atrium to the right ventricle, and then it goes through the semilunar valves here, and it goes into the right and left pulmonary arteries, and the pulmonary arteries enter the lungs. Now, they're arteries because they go away from the heart. Okay, so they're going away from the heart, they're arteries. And so then the pulmonary arteries enter the lungs there on number 2. And number 3, the pulmonary artery branches into lobar arteries, one for each lobe of the lung. And these arteries branch into smaller and smaller arteries until ending at the capillary beds. So this indicates the capillary beds. And then the capillaries surround the alveoli, where the exchange of oxygen for carbon dioxide happens. And the capillaries form venules, which merge to form veins. The veins, which carry blood toward the heart, they merge until forming the pulmonary vein, which returns the oxygenated blood to the left atrium. So it's very important. Arteries take blood away from the heart. Veins take blood to the heart. Very important. So view this animation on pulmonary circulation. Now, the next thing is systemic circulation. That supplies oxygen and nutrients to the organs, and it removes the waste. So all systemic arteries arise directly or indirectly from the aorta. The aorta originates in the left ventricle and is divided into 3 regions. The ascending aorta rises a few centimeters above the left ventricle. The right and left coronary arteries branch off the ascending aorta to supply blood to the myocardium. So the heart gets the freshest and best blood. It's just right out of the aorta, goes to the coronary arteries. The aortic arch curves over the heart and turns downward behind the heart, making inverted U shape. The aortic arch branches into 3 major arteries: the brachiocephalic artery, which through its branches supplies blood to the head and right arm; the left common carotid artery, which extends into the neck; and the left subclavian artery, which supplies blood to the left shoulder and upper arm. The descending aorta travels downward, dorsal to the heart, through the thoracic and abdominal cavities. It is called the thoracic aorta above the diaphragm and the abdominal aorta below the diaphragm. The abdominal aorta branches into the right and left common iliac arteries, which supply blood to the lower pelvis and the leg. So this is the aortic arch. This is the ascending aorta. This is the descending aorta, the abdominal aorta. The thoracic aorta is above the diaphragm, abdominal is below the diaphragm, and then the right and left common iliac arteries. Now, you've probably already, in health assessment, you probably have already done some, I know in fundamentals, you've learned how to take a pulse, and you have pressed the artery in the radial artery against the radial bone, and as you press it, you can feel a pulse. So each beat of the heart produces a surge of pressure, and that's what you're feeling where the artery comes close to the body's surface, and you're pressing it against that bone, and you can feel it pulsing, and that's the beat of the heart. You have some of the ones that you're probably going to learn is carotid artery, like you take in CPR, if you're concerned if a person has a heart, if their heart's beating. You have the brachial artery, the radial artery, the femoral artery, popliteal artery, which is behind the knee, the posterior tibial artery, and the dorsalis pedis artery. These are the pulses. This is what we're feeling to see if we're getting circulation to everywhere in our body. Now, the principal arteries, principal arteries, they're the thoracic aorta and its branches. Supply the chest wall and the organs within the thoracic cavity. So the principal arteries, we're talking about the thoracic aorta and its branches. So the branches off the aortic arch supply the blood to the arms, and the abdominal aorta and its branches supply blood to the abdomen and lower extremities. So the arteries of the head and neck. Because the brain requires a constant supply of oxygen, 2 arteries supply it with blood. The path of blood flows upward from the heart. At about the level of the Adam's apple, each common carotid branches into the external carotid artery, which supplies most of the external head structures, and the internal carotid artery, which enters the cranial cavity and supplies the orbits and 80% of the cerebrum. The right common carotid artery arises from the brachiocephalic artery. The left common carotid arises from the aortic arch. The vertebral arteries arise from the right and left subclavian arteries. Each extends up the neck through the cervical vertebrae and enters the cranium. On the undersurface of the brainstem, the 2 vertebral arteries unite to form a single basilar artery. Branches from the internal carotids and basilar artery form several anastomoses to create a circle of arteries at the base of the brain called the circle of Willis. An anastomosis is where 2 things come together. And anastomosis can be like if you cut 2 arteries or 2 veins and you put them together and you sew them together, that would be an anastomosis. But these are naturally occurring anastomoses, and they create this circle called the circle of Willis. And the complete circle of Willis is 2 anterior cerebral arteries, a single anterior communicating artery, 2 posterior communicating arteries, and 2 posterior cerebral arteries. So this shows you how it is in the brain, and this takes it out so that you can see. And it's called the circle of Willis. And so that's on page 303. So now let's look at the principal veins. The vena cava is the body's main vein. It's divided into the superior vena cava, which the SVC, which receives blood from the head, the shoulders, and the arms, and the inferior vena cava, IVC, which receives blood from the lower part of the body. So some veins drain directly into the superior vena cava. Others drain into a second vein, which may merge with still another vein before draining into the vena cava. Superficial veins reside near the body's surface. Deep veins lie in deep, well-protected areas, often alongside bones and their corresponding artery. When we are talking about thrombosis that is caused by pooling of blood in the veins, we're calling it deep vein thrombosis. So the veins of the head and neck, you have the internal jugular vein, which receives most of the blood from the brain and the face. The internal jugular vein merges into the subclavian vein, which becomes the brachiocephalic vein. The brachiocephalic vein drains into the superior vena cava. The external jugular vein, the more superficial of the jugular veins, it drains blood from the scalp, the facial muscles, and other superficial structures, and then drains into the subclavian vein. The vertebral vein drains the cervical vertebrae, spinal cord, and some of the muscles of the neck. So the hepatic portal circulation is a specific circulation, and there's a whole animation on this, which would be very important to watch, because this is a separate circulation. Sometimes in some anatomy books, you'll see this taken out and a whole chapter be just on the hepatic portal circulation, because it's a separate circulation. It's really important. The liver is the next to your brain. It's a very, very important organ in your body. And I remember years ago I read that the liver has over 500 functions. Now I don't know, that by then they may have found 500 more, but has so many functions, and it requires its own circulation. So veins from the digestive organs and the spleen, they send their blood through the hepatic portal vein to the liver. So this allows the liver to remove excess glucose, such as after a meal, as well as toxins and bacteria before the blood returns to the heart, because one of the main functions of the liver is detoxification and getting rid of toxic elements. So blood from the capillaries of the spleen, the stomach, the pancreas, the gallbladder, and the intestines, all that blood flows into the superior mesenteric vein and the splenic vein, which converge to form the portal vein. Blood from the left and the right gastric veins empty into the hepatic portal vein. The portal vein channels the blood into the liver. The blood is then distributed to innumerable microscopic sinusoids, which are the capillaries of the liver. The blood flows out of the sinusoids into the hepatic vein, and from there into the inferior vena cava, where it is returned to the heart. So please take a look at this circulation. This animation on the circulation should help you to get a good understanding of it. So the portal system allows blood to what? The answer is A, pass through 2 capillary networks before returning to the heart. Helps it to do its job. So we're going to look at some principles of circulation. The blood flows because of differences in pressure between 2 structures, which is called a pressure gradient. As blood moves away from the heart, blood pressure declines. The greater the difference in pressure between 2 points, the greater the flow. As blood flows, it meets resistance. The greater the resistance, the less the flow. So we have these things. When it first leaves the heart, we have a pressure gradient. And as blood moves away from the heart, the blood pressure declines. And the greater the difference in the pressure between the 2 points, the greater the flow. As blood flow, it meets resistance. The greater the resistance, the less the flow. So you can see by this graph that when the differences between the pressure gets smaller and when the resistance increases, it's going to lessen the flow. So these are principles of circulation. And there's different things that affect blood pressure. Cardiac output, which we talked about, blood volume, and resistance. So a proper blood pressure is crucial for proper body functioning. Blood pressure is determined by cardiac output, blood volume, and resistance. So cardiac output, when the heart beats harder, such as during exercise, cardiac output increases. When cardiac output increases, blood pressure increases. When cardiac output falls, such as when exercise ends or the heart is weak, blood pressure falls. So a rise in cardiac output from the heart beating harder increases cardiac output, and that increases blood pressure. When the cardiac output falls, blood pressure falls. So blood volume. When blood volume declines, such as from dehydration or hemorrhage, blood pressure falls. To try and preserve blood pressure, the kidneys reduce urine output, which helps boost blood volume and raise blood pressure. Resistance, also called peripheral resistance, is the opposition to flow resulting from the friction of moving blood against vessel walls. The greater the resistance, the slower the flow and the higher the pressure. The lower the resistance, the faster the flow and the lower the pressure. If you think about little babies have very low blood pressure. They don't need much blood pressure, and their little vessels are squeaky clean, and the blood can just zip around the bloodstream without any problem. When you get older, your arteries tend to harden. You might get some plaque on your walls, and this is going to increase resistance, and so blood pressure rises. So let's look at peripheral resistance. When we talked about blood, we talked about viscosity. Viscosity is the thickness of the blood. So the greater the viscosity, the slower the flow. It's just like, have you ever heard the expression slower than molasses in January? Molasses is thick like honey. And if you pour in a glass of water and a glass of molasses, you're going to finish emptying out that glass of water a lot faster because of the viscosity of the molasses. So the greater the viscosity, the slower the flow. Viscosity is typically stable. Therefore, adjusting the diameter of the vessels is the body's chief way of controlling peripheral resistance. So typically in our bodies, the thickness of the blood remains stable. So what the body can do is change the diameter of the vessels to increase or decrease peripheral resistance. So you have vasoconstriction. Vasoconstriction increases resistance, which causes blood pressure to rise and blood flow into tissues to decrease. Vasodilation decreases resistance, blood pressure declines, and blood flow into tissues increases. The elastic property of healthy arteries allows them to expand with each beat of the heart and to absorb some of the force of ejected blood. When the heart is in diastole or relaxation, the arteries recoil to prevent blood pressure from dropping to zero. This expansion and recoil helps propel blood downstream toward capillaries and also helps smooth out surges of pressure that occur with systole, protecting smaller arteries. So blood velocity. Flow is fastest in the aorta. It's a large vessel and it's close to the left ventricle. By the time the blood reaches the capillaries, it's slowed considerably because capillaries are far removed from the left ventricle. Friction along the way has slowed the flow. The smaller diameter of arterioles and capillaries has put up more resistance, and the number of vessels has become greater, giving capillaries a greater total cross-sectional area. So blood flow through the capillaries is slower than in any other part of the vascular system. So this slow flow rate allows capillaries time to exchange nutrients, waste, and gases with surrounding tissues. From the capillaries to the vena cava, velocity rises again because veins have larger diameters than capillaries and because they have a smaller cross-sectional area. So the question is, which condition would you expect to accompany atherosclerosis, a disorder in which arteries lose elasticity and fatty material builds up inside the vessels? Would you see an irregular heartbeat, low blood pressure, increased blood viscosity, or high blood pressure? Well, the answer is D. You're going to see high blood pressure. The accumulation of that fatty material, like I was calling it plaques, it narrows the vessel diameter. It leads to a higher blood pressure. A loss of arterial elasticity prevents arteries from expanding with each beat of the heart, which also contributes to higher blood pressure. So we're going to look at the nervous system work in all this. The neural regulation of blood pressure. So the vascular system can quickly adjust blood pressure and alter the flow of blood to respond to the body's changing needs. This occurs because of input from the nervous system and the influence of certain hormones. So the neural regulation, it starts out with the baroreceptors in the carotid sinus and aortic arch, detect changes in blood pressure, and it transmits signals along the glossopharyngeal and vagus nerves to the cardiac control center and the vasomotor center in the medulla. If the pressure is too high, the medulla increases its output of parasympathetic impulses. This causes vasodilation. Heart rate and stroke volume decreases, and blood pressure drops. If the pressure is too low, the medulla increases its output of sympathetic impulses. Vasoconstriction occurs, heart rate and stroke volume increase, and blood pressure rises. So this is how the nervous system, it regulates blood pressure. So take a look at this animation on neural regulation of blood pressure. How do baroreceptors factor into this? Make sure you take a look at that. Now there's the hormonal regulation of blood pressure, which we talked about a bit. There's a number of hormones that raise blood pressure. Renin, angiotensin 1, angiotensin 2, aldosterone, antidiuretic hormone, or ADH, epinephrine and norepinephrine, and one called atrial natriuretic peptide, which causes the blood pressure to fall. So there's hormones that raise blood pressure and hormones that cause the blood pressure to fall. So renin, angiotensin 1, and angiotensin 2, let's follow along in the book here. Let's get to the... Here it is, hormonal regulation of blood pressure. It's in page 310 on a nice chart, and you can look at that. So renin, angiotensin 1, and angiotensin 2, they cause vasoconstriction and water retention through an interactive mechanism. Aldosterone is secreted by the adrenal medulla when blood pressure falls. Aldosterone stimulates the kidneys to retain sodium. Water follows sodium. That increases the blood volume. In the antidiuretic hormone is secreted by the posterior pituitary gland when the water content of the body falls. The ADH promotes vasoconstriction and water retention, which will raise blood pressure. Epinephrine and norepinephrine, they're secreted by the adrenal medulla when the body is under stress, and these hormones cause vasoconstriction. Epinephrine also increases heart rate and force of contraction. Now, the ANP is different. It's released by the heart's atria when elevated blood pressure stretches the walls of the heart. So ANP causes vasodilation. It also stimulates the kidneys to excrete sodium. So if the kidneys excrete sodium, water follows sodium, which reduces blood volume. Another thing that affects this is the venous return. So most of the veins must fight the forces of gravity to deliver blood back to the heart. There's two key mechanisms in venous return, the skeletal muscle pump and the respiratory pump. The skeletal muscle pump works because the veins of the legs are surrounded by muscles. When the muscles contract, they massage the veins, propelling blood upwards toward the heart. The valves in the veins ensure that the blood flows upward toward the heart. When the muscles relax, the blood flows backward, pulled by the force of gravity. Blood puddles in the valve flaps, keeping the valve closed and preventing further backward flow. So as we walk and as we move, the muscle pump puts pressure on the veins and moves the blood up. And as it goes up from valve to valve, it doesn't go backward because the valves close, and it causes the blood to only move forward or upward. So this shows contracted skeletal muscles and relaxed skeletal muscles. Now, the respiratory pump happens when we inhale, the chest expands and the diaphragm moves downward. This causes the pressure in the chest cavity to drop and the pressure in the abdominal cavity to rise. The rising abdominal pressure squeezes the inferior vena cava, forcing the blood upward toward the thorax. The lower pressure in the thorax helps draw the blood toward the heart. Valves on the veins in the legs make sure the blood doesn't flow backward. So the respiratory pump and the muscle pump help to move the blood, the venous blood, toward the heart. When blood pressure suddenly rises, which structure sends out parasympathetic impulses? Is it the medulla, baroreceptors, the aortic arch, or the atria? The correct answer is A. It's the medulla. Baroreceptors in the aortic arch detect changes and send signals to the medulla. The atria release the hormone atrial natriuretic peptide in response to high blood pressure. Okay, so that is the end of chapter 15, part 2.